Aloha, my name is Dr. Nathan Ehrlich. I'm a naturopathic physician in Maui, where I've been practicing since 1988, and I've been doing regenerative medicine since about 2003, where I started first with prolotherapy and now do a significant amount of platelet-rich plasma therapy and prolotherapy, which is a form of prolotherapy. PRP stands for platelet-rich plasma therapy. It's basically utilizing a part of the blood, the platelets, that are responsible for tissue repair and regeneration. There's often a few different types of procedures that you can do if somebody's really hurt bad. Cortisone and corticosteroids are typically one of the last efforts that you can do before you typically undergo surgery. Platelets have been studied and compared to corticosteroids in tissue repair and have been found to be more effective, and they're safer. We've had great results with treating the following injuries with PRP, from tennis elbow, which is lateral epicondylitis, knee issues such as MCL, LCL, ACL ligament tears and meniscal tears, osteoarthritis of the knee, which is where the bone starts to degenerate and loss of cartilage, plantar fasciitis. A whole host of musculoskeletal complaints can be treated with PRP very well. PRP varies in the amount of pain that a patient will experience when they receive it. Sometimes it doesn't hurt at all, and sometimes it does produce some pain. Some of my patients who are professional athletes are concerned with the legality of PRP if it's considered blood doping, and it is not. It is totally safe and considered legal by the International Olympic Committee, and it is pretty much just used exclusively for healing. It is not used for performance enhancing. There's a good degree of variability with how long it's going to take for patients to resume activities after a PRP treatment. It can be from literally a few days to a couple of months, and it depends on the severity of the injury. It can depend on their age, their overall level of activity, and typically the kinds of activities that they're going to try to resume. I'm often asked how many treatments a patient needs for complete healing, and that again is going to be somewhat variable from patient to patient. That also depends on a patient's age, their vital force, how well they heal, and then the severity or the degree of whatever it is that has been damaged in terms of the injury. So it can be from typically one treatment, and often we give a treatment a period of time of a few weeks to see how well the patient responds. Anywhere after a few weeks, maybe 3 weeks on, we could repeat the treatment. But typically you like to see how well the patient does and the percent of recovery. Often it's just one treatment that's needed, remembering that it's going to continue to improve over the course of a long time, meaning a year or two. Even though the rate with which the improvement occurs starts to slow down, it still does improve over a longer period of time. I'm also asked the question about how PRP works either in place of or in conjunction with physical therapy. I look at PRP as a wonderful way for other therapies to actually take better effect. When there's ligament damage, then people that are undergoing physical therapy or workouts or training of some sort have a lot of challenges in front of them, because like a door with hinges that have come loose, that door isn't going to work properly until the hinges are fixed. And that's like the body as well. Muscles and tendons are not going to be fully functional unless you address the issue of the ligament problem. So PRP excels at being able to treat ligament issues, which then allows the muscles to not have to do the compensation that they do to splint a joint that is poorly being braced by damaged ligaments, thereby allowing physical therapy or other forms of therapies to become more effective. PRP, fortunately, has very minimal side effects because we're utilizing the body's own blood for the treatment.